Right. Very good morning to you. Thank you very much for affording me this opportunity to talk with a relatively short time, of course. But we have been listening to the talks from the morning, uh, the importance of various interventions, bundles to the treat the sepsis and the infection. But as a surgeon, we know sometimes whatever the fluids or the antibiotics which go in will not save the patient unless you control the sepsis and get the infection out of the patient. So it is a very important aspect in management of sepsis. We don't have anything to disclose. My the talk I'm going to talk the highlight the importance of source control in sepsis and the methods of source control and the causes of delay and how to improve the outcomes. Right. So the Surviving Sepsis campaign guidelines itself, the 2021, it highlights the importance of source control as a best practice statement. Uh, we heard this earlier. Also, the World Health Organization has stated there are so many deaths which happen uh, due to sepsis, and it actually, as one of the speakers said earlier, supersedes trauma deaths as well. Right. So this is one of the actual view of a patient who had a bowel perforation. So as you know, you can see the contamination and whatever antibiotics or fluid or you give, unless you remove this infection from the patient is not unlikely to survive. So in what are we going to achieve by source control? First of all, to eliminate the source of infection. If it's a bowel perf, we need to close that bowel and wash out the contamination. And we need to again control ongoing contamination that again may be repeated surgeries or wound toilets or surgeries as well as antibiotic and fluid care. And of course, as we know, physiology is more very important. So we need to restore the premorbid physiology and anatomy normal function. So those are the aims of source control. So, importance of sales control. There are several trials which have been done to highlight the importance and the time duration of time duration of source control. So, this one of the well-known studies, the Medusa trial, which shows clearly the delay in antimicrobial therapy and the source control was associated with increased mortality. There are several other studies as well. This is one of the studies which shows a delay in source control beyond 6 hours may have a major impact. Association between time and source control. So this is one of the studies which have shown the time duration where your source control has to be done, and so it is here said 6 hours control within 6 hours. So again, this is another study which was shown to the target time for the favorable outcome may be within 6 hours. So source control, if at all, I think as it is stands now, again, this is Royal College of Surgeons of England statement saying that within 6 hours of source control, as well as uh, if the patient is septic and in shock, to do it immediately. Uh, so the Surviving Sepsis guidelines says again, recommendation is as soon as medically and logistically practical after the diagnosis is made, and within the suggestion to do so within 6 to 12 hours window after the diagnosis. So again, the timing is more or less recommended in various studies to do probably within 6 hours of time. So core element of source control, what are we going to do? We can drain things, we can debride, we can device removal if the device is causing the infection, or we can go to definitive measures such as laparotomy. These slides will show the various foci of sepsis. I'm not going to go detail because it's a can cover within this time. So, I mean, you can see, I'll specifically focus on the abdomen. So, if it is abscess in the liver, spleen, or in the pelvis, it has to be drained. And if it's a peritonitis, may have to have a laparotomy, and it can be even done sometimes minimally invasive method. If it's a skin sepsis such as necrotizing fasciitis, obviously patient will have to go to theater. So there can be minimal invasive procedures which are done by interventionalists, or sometimes they are done. A surgeon needs to be brought in. This damage control surgery concept has probably been borrowed by from trauma, which has been applied to sepsis laparotomies as well. I think it is important to highlight the importance of the urgency in dealing with septic patients who need laparotomy in the same urgency that you treat a patient who need a trauma patient who needs laparotomy. So I think that the concept is being established here. So here the stage initial resuscitation is the stage zero of the damage control, very similar to trauma laparotomy. So sepsis laparotomy again stage zero is resuscitation. Stage one is initial laparotomy in order to establish uh, the drainage of sepsis and wash out, and maybe creating stomas, and maybe a temporary abdominal closure if that is appropriate. Then again patient will go to the ICU in the stage two, where the patient is optimized with antibiotics, fluids, and monitoring. And then again, he can come back to theatre if that is necessary for a maybe continuity of bowel or other procedures. And later on, if the patient has open abdomen, the definitive dose of procedures can be done at a stage 4 procedure. So when we have defined a time duration of 6 hours, so what are the causes? Why should a patient be delayed in going into source control? So there may be diagnostic delay and interventional delays as well as some patient factors. So lack of knowledge in the first contact, especially the junior doctors who deal with these very unwell patients in our primary care setups, and the and also underestimation of sepsis. Sometimes patients come with marginal blood pressures of systolic 90 to 100, and that time it is not recognized as a sort of critical condition where they are taken lightly. Underestimation is one of the causes for the delays. And of course, delay in diagnostic tests, as we know, many other tests such as X-rays or CTs or ultrasounds can get delayed. So that is the diagnostic delay. And delay in interventions can be due to a non-availability of interventionist or a surgeon, or facilities to do such procedures. And patient factors also include unstable patients and complex conditions where there are many specialties have to get involved in treating the patient. So how do you reduce the delays? So implementing the sepsis protocols in hospitals. So this has to be uh, done with the senior consultants and doctors, as well as the junior most, the intern house officers, as well as the nurses. So implementing and promoting the protocols. And of course, continuous education such as these programs should drive in the importance of the adherence to the protocols. And now a new team like sepsis team is a multidisciplinary team which has a team leader uh, which will address when a patient of sepsis or suspected sepsis is admitted. So this team will quickly go and get every aspect of uh, preparing, prepare, preparing the patient as well as diagnostics as well as the taking the patient to an interventional procedure. So a team which is dedicated to this will obviously hasten the quicken the procedure of taking the patient to uh, necessary intervention. And also, like very similar to shock room in trauma, they have indicated that a septic shock room to be implemented where a patient who is diagnosed of sepsis to be brought in and then treated vigorously with the multidisciplinary team. And of course, a proper plan has to be drawn for each patient. It has to be customized according to the requirements of the patient. So, the reducing the delays, the focus is the point of care ultrasound, which has shown to be very effective. So it is diagnostic as well as will aid in registration to see the fluid management, vascular access, as well as therapeutic drainage. So one of the other things in source control, use of point of care ultrasound is quite emphasized. Right. In summary, the source control in sepsis is one of the cornerstones of saving lives, and any delay in failure to do so has is costing so many lives as well as it will cost in the future. So timing of source control is very important. At the moment, it's usually advised within 6 hours from the diagnosis to the intervention time. And a multidisciplinary team approach, which includes the doctors, the nurses, the microbiologists, the sonologists, and the intervention radiologists, as well as the surgeons, to be part of uh, the management of the septic team. Thank you.